What's the relationship between children and the COVID-19 vaccine? Well, on VAX Matters, you'll find out. In this episode, we jump back into another highly discussed topic, the distribution of the COVID-19 to children. Now, we do realize this is a sensitive subject, but we're very glad to welcome Dr. Evelyn Twentyman to talk through this issue with us. Dr. Twentyman brings a vast amount of expertise as a medical epidemiologist for the Centers for Disease Control and Prevention. Thank you so much, Dr. Twentyman, for taking the time to be our guest today.
Thank you so much. Thanks for having me here.
Absolutely. And I believe we really just need to start, as we always do with our podcasts, at the beginning with the obvious question. Could you please start out by telling us what is the current COVID-19 recommendation for children?
Thank you so much. That is a great question to get us started with. I'm happy to say that we have recently been able to simplify our recommendations for COVID-19 vaccines, including for children. So right now, here are the recommendations. Everyone ages 6 months and older is recommended to receive a primary series of any age-appropriate FDA-approved or authorized monovalent COVID-19 vaccine. Now, those folks ages 5 years and older are also recommended to receive one bivalent, this is updated, mRNA booster dose after completion of any one of those FDA-approved or authorized primary series. I'll also just note that there's a ton of flexibility here. Monovalent vaccines are no longer authorized as booster doses, but you can mix and match boosters and primary series. So if a kiddo over the age of 5, for example, anyone ages 6 years or older received a Pfizer primary series, they can get a Pfizer or a Moderna bivalent booster. If they received a Moderna primary series, they can get a Pfizer or a Moderna bivalent booster. The one slightly complicated exception is because Pfizer and Moderna tested their COVID-19 vaccines in different age groups for people ages 5 years old. So just those kiddos age 5 years old, only the Pfizer bivalent booster is authorized. So it's real simple for them. They can get a Pfizer primary series and a Pfizer booster. But just to summarize again, everyone ages 6 months or older, get your primary series. Everyone ages 5 and older, get that updated bivalent booster after you've done that primary series.
We're really appreciative that you're going through this again, Dr. Twentyman, because it seems like throughout all of this that we've been dealing with over the past months and now years, the rules kind of change on a dime. And it's really hard, and especially for parents who want to do the best thing for themselves, because they have to keep themselves healthy to take care of their children, to know about their children and what they need to do to take care of them. I think one thing I wanted to ask you, when you're talking about the vaccines that are approved for children and authorized, what is the difference? I'm assuming there is a difference.
Yes, for sure. And I want to acknowledge that, yes, we have seen many changes to COVID-19 vaccine policy, like you just implied right now. You are spot on. That is because we in public health have just been working so hard to review all the data that exists on any of these vaccines and just get these life-saving vaccines to everybody as soon as we can. But that's meant that since the dawn of the availability of these vaccines, indeed, you've seen de-escalation in age to now everyone ages 6 months and older can get it. And for a bit there, it was a little complex how many boosters a person might need or not need. And now with the dawn of the bivalent boosters, it's real simple again, and everyone just needs one. So yes, there have been a lot of changes, and thanks for sticking with us as we continue to review all this data and make these changes to protect public health as much as possible.
And I'm
Now I
sure.
want to get to your, oh, sorry.
No, please continue. I didn't mean to interrupt.
Oh, I wanted to get to your question on authorization versus approved. And this is an important difference. It's something that is particularly important during the COVID-19 pandemic. So emergency use authorizations are a form of tentative approval that the FDA can give a vaccine product when we know that there is like an emergent public health need, like COVID-19, for example. And we know that companies won't have years of data yet, won't be able to make the license applications yet, but we have confidence that a vaccine is safe, that a vaccine is effective. The FDA has been using emergency use authorizations to make sure that those life-saving vaccines become available to Americans as soon as they are safe and effective. So in other words, as soon as it's appropriate to do so. Now, many vaccines now at this sort of later stage in the pandemic, when we now have had the opportunity to see these vaccines in use for more than a year and been able to collect a lot of data, actually many of the vaccines now have licensure, meaning approval, meaning there's nothing tentative about the approval for Moderna vaccine for adults, for example, or for Pfizer COVID-19 vaccine for anyone ages 12 and above. So in other words, those older kids and adolescents have an approved vaccine available, not just one under emergency use authorization. So that's the difference between the emergency use authorization and approval. And that's why emergency use authorization has been so important to meet the demands of this pandemic.
And I think that is very logical and it makes sense. But sometimes, those of us who are not in the medical field, you see these words and you kind of think about them, you kind of chew on them and you think, okay, I know there is a difference, which is better. Which do I need to know about? But thank you. We needed that clarification. So tell me a little bit about how in demand the COVID-19 vaccine has been for the youngsters now that it's available and the parents know about this.
It is available. I sure hope parents know about this.
Me
because
too.
This is the very best way that we have of protecting our kids from COVID-19 disease. And, this is a big priority for me as a parent of two young children. I want to do everything I can to protect my kiddos. And I know that lots and lots and lots of other parents across the U.S. Are right there with me. Unfortunately, we've seen that the uptake of these vaccines has not been great among children. And so one of the reasons I'm so grateful to be here speaking with you today is to share this information with you and to hopefully communicate that these vaccines are available right now. If your listeners are inside the United States, they can get their children vaccinated today with one of these vaccines. They are safe. They are effective. Unfortunately, for kids 6 months through 4 years of age, just about 1.4 million children have had at least one dose of a COVID-19 vaccine, which is just under 7% of all the children in that age group. And by the way, that's just one dose. That's not even to say have completed the whole primary series. Unfortunately, that number is more like 3% of this age group. Yeah. And then in the slightly older kiddos, the children ages 5 through 11 million first doses have been given. So that's 38.6% of children. Again, just a first dose. And then only 1.4 million booster doses have been given. So that is just 15% of children who have completed a primary series, and that is a very small number of this age group overall. And then moving up again into adolescence, so those ages 12 through 17, about 70% have received at least one dose, and about 30% have received both a primary series and a booster dose. So overall, the numbers are not small. The reason we've been able to collect such amazing and reassuring data on safety is that more than 30 million children and adolescents have received at least one COVID-19 vaccine dose. So there is some good news, but despite this great progress, there's a lot more work to do to increase coverage among children, especially as you might have heard, in those under the age of 12.
Do you have any thoughts on why this is the case? Frankly, yeah, I'm not in the medical profession, but the numbers that you just gave, I'm surprised. I'm surprised that the numbers are so low, especially for the younger ones. You know, the adolescents look like they're kind of catching up, but the parents, is it the vaccine hesitancy? Is it misinformation? What do you think? I'm just curious.
Well, I think it's probably different for different parents. I think a few things that I'll just reflect a few of the things we've heard, and then what I would offer in response to a parent that I cared about, of kids that I care about. So one of the things that we hear is, well, these vaccines have not been around very long. Are we sure they're safe? And I want to say that I appreciate and admire the desire to keep our children safe. That's our main job as parents, is keeping our kids safe. I can say with great confidence that these COVID-19 vaccines and boosters are very safe for our children. Sadly, COVID-19 disease is not safe for our children. And so I really like to encourage parents, get that vaccine, give your child the best possible chance of doing really well if they get infected with COVID-19. Give them the chance of reducing their risk of infection. Give them the chance of having the healthiest, happiest childhood they can.
Absolutely,
with all
yes.
those vaccines on board.
Yeah.
And in terms of new, I guess in comparison with some other vaccines, these vaccines are new, but fortunately we have now had years of experience with these vaccines since they first were developed in 2020, and we have been monitoring them under the most intensive vaccine safety surveillance program in the history of the United States of America.
Absolutely.
So we have been watching them real closely. And then the other reflection that I sometimes hear from parents, in fact, I'll say I actually heard this last night when I was at the jujitsu class of one of my children. I was speaking with another mom, and she said, I don't know if I'm going to get my son vaccinated. I won't use his name, but he was in the jujitsu class with my son. I don't know if I'm going to get him vaccinated because, he had COVID once, and I appreciate that. And, a lot of us grew up in the era before the chickenpox vaccines. So we remember our parents taking us to get chickenpox when we were younger to avoid having the severe course when we were older because no vaccine existed. And then maybe we think, well, then that must mean if our child has had COVID-19, then they don't need a vaccine. So I sort of understand the perspective, like where that might be coming from. But here's what I said to my friend, that mom of that child, the friend of my son in class with him. I said, the very best thing we can do to help our children as we face the continuation of this pandemic is to get them this vaccine. It's really unfortunate that this virus keeps getting transmitted, and it is it is still all over the US. It keeps changing. But, we are reviewing the data all the time. We are updating those vaccines as the virus itself keeps changing. We're changing the vaccines. Go get your child vaccinated. This child was over the age of 5. So I said, I would recommend you get your son vaccinated and boosted. We know that he'll have a better chance against COVID-19 the next time he gets it than a child who's not gotten the vaccine, even if both of them had COVID-19 before. We all want to do what's best for our kids, and what's best for our kids is getting vaccinated.
And that's what you were saying, that you kind of understood what she was saying because her son had COVID. Evidently not a really serious or severe case because he's fine and he's in class with your son. But I believe that maybe people think, well, I think back in the days too, before the flu vaccine was so prevalent that, I've had the flu, so I don't need to get, a flu shot because I've already had it. And sometimes we kind of go down that rabbit trail of thinking, no, it's not a big deal, but it is a big deal. And especially for the children. And as you said, they're going to be around other children. And I've had friends that they've had COVID multiple times, not just once. And as you said, it's unfortunately, ever evolving. And it's going to be a way of life for a long, long time.
Yes, but we can meet this challenge.
Yes.
The flu has been with us for a long, long time, and we figured it out. With flu, we get our annual flu vaccine. That was a great example to bring up because we know that people do better with the flu if they do get the flu, if they had that vaccine. We also know over time, people are less likely to get the flu if they stay up to date with their flu vaccine. And so, yeah, similarly to the flu, we meet that challenge. We will meet this COVID-19 challenge. And if you're a parent listening, you can do your part by getting vaccinated yourself and by getting your kiddo vaccinated too.
I have no children, so I'm only speaking through my experience as an adult. I've had the vaccine. I'm triple boosted. Happy about that. I got my flu shot, about a month or so ago. So I feel good to go. Now, if I get sick, it's not because I'm not being cautious and taking care of myself and being proactive about my health. I think that's how so many people need to reflect upon and need to do it. But I'm only familiar with, as an adult, what I need to do. Could you be just a little more specific about the differences of the vaccine and the boosters for the children and the teens? Because I'm not familiar with that age group. And you were talking about that some of them need 1 or 2 boosters or 3 or the vaccines. I'm sorry. I kind of, there's a lot of information there. Could we go back over that again, please?
Yes, absolutely. So, and I'll drill down into more specific. So let's do the same thing we did at the beginning of our chat. We'll start with the youngest kiddos and then we'll go up in age. So let's talk about the little ones first. So the children that are less than 6 years old. So children ages 6 months through 5 years, in other words, up to the age of 6, have a primary series recommendation of 2 doses of Moderna or 3 doses of Pfizer if they're ages 6 months through 4 years.
Okay.
Because as I think I implied, the 2 manufacturers for this age group studied slightly different ages. So for kids ages 6 months through 5 years, a primary series could be 2 doses of Moderna, or for kids ages 6 months through 4 years, 3 doses of Pfizer,
okay.
COVID-19 vaccine. Now let's go up to the next category. Children ages 5 through 17 can get a 2-dose primary series with Pfizer, or children ages 6 through 17 can get a 2-dose primary series with Moderna. So as you can see, it's already gotten a little more simple.
Yeah.
And then everyone ages 5 and above can have one of our updated bivalent boosters. And they just need to wait at least 2 months after completing their primary series. And like I mentioned before, you can mix and match. If you got Pfizer for the primary, you can get Moderna for the booster. If you got Moderna for your primary, you can get Pfizer for the booster. And so that's what we're encouraging everyone to do. I don't know if you want to go into recommendations for people with moderate or severe immunocompromise, but I'll say some people are recommended to actually get a 3-dose primary series, whether Pfizer or Moderna. But those are those folks with weakened immune systems, either due to cancer, for example, or treatment of a cancer that's currently in remission, or an organ transplant, or maybe some primary immunodeficiency, meaning like a something someone was born with. And so those folks are recommended to receive a 3-dose primary series. Because we're going into the details at this time, I'll add too that there is another vaccine platform available for adolescents. The VAX COVID-19 vaccine is also now available as a primary series for children, or rather adolescents, ages 12 through 17. And that is a 2-dose primary series, whether or not a person has immunocompromise or a weakened immune system.
So when you were talking about the weakened immune system, that could go for adults or for the young people or for the children. Is that correct? I didn't understand that correctly.
That's correct. That's correct. There are some exceptions, like, for example, with the Novavax COVID-19 vaccine, that's still a 2-dose primary series, regardless of whether you have a weakened immune system or not.
So you have basically, it sounds like the adult situation that you have the primary series, and then you continue with boosters for the youngsters as well. Does that, with adults, every so often, you hear, okay, we've got this new variant, time to get another booster and what have you. So is that what we're looking at with children too, that pediatricians will let parents know when it's time for another booster? Or how does the booster come into play after the primary series, doctor?
Correct. So right now we have a much simplified situation, because right now we all get to stop counting boosters. And if your age is
that sounds good.
Yeah, 5 years and older, if your age is 5 and up and you've completed your primary series, you just need one updated, that is to say bivalent booster, and you are up to date with your COVID-19 vaccines. Doesn't matter how many boosters you received in the past.
Okay.
You're good to go with your updated bivalent booster. Now, we have gotten the question, what does this mean in the future? When will we need another booster? And we don't know exactly when. We are hoping to move toward a model that you might recognize as very similar to the model of the flu, where we get a booster every once in a while, maybe every year, for example. And then that way we just stay up to date forever by just getting a regular booster. Now, we don't know yet what exactly that model will be, because this virus hasn't been around very long yet. Yeah. We're still collecting data all the time. We're still understanding if this virus has seasonality, what that seasonality is, meaning what that like regular recurrence is, what that looks like. But what I can assure you is that CDC is here to be obsessing over that data, learning from it, characterizing it, and making the best decisions about boosters based on that we can offer.
And this virus is just tricky. Right when you think you've got it under your thumb, it says, I'm going to throw you just a little something, monkey wrench into the works, and to make the brilliant minds there at the CDC just, are you kidding me? But like you said, it's always, now that this is it's been 2 years now or longer or counting or whatever, that it's in our national, the worldwide consciousness that we want to do what we need to do so that we don't have to go back to being on that critical lockdown and everything shutting down. Who would have thought the world would have been shut down for as long as it was? And I guess in the overall scheme of things, Dr. Twentyman, it could have been a lot longer. If we didn't have these minds working on this feverishly and getting what we needed to do to get us healthy again or give us a chance at being healthy.
Oh, let me tell you, vaccines, COVID-19 vaccines changed the game. They decreased our risk of hospitalization. They decreased our risk of death. They lightened the load on our terribly overburdened healthcare systems. They didn't. Many people will say, they didn't fix everything. They didn't end the pandemic forever. And gosh, I join everyone in wishing that they had. But man, they sure reduced the risk of serious illness, hospitalization, and death. They saved our healthcare systems to be able to address other causes of serious illness, hospitalization, and death. Our cancer screening rates could go back up again with the advent of the vaccines and the decreased burden on our healthcare systems. Our care for acute cardiovascular conditions could rise again. These vaccines have made a world of difference, both in counteracting COVID-19 disease itself and saving the strength of our healthcare systems for these other threats to our health.
And they're out there. There are definitely threats, and they will continue as long as there's a human race. You can't say, well, we're going to obliterate this or take care of that. I mean, it's kind of pie in the sky thinking for people who are not thinking straight. We're just doing such a phenomenal job of trying to understand, keep ourselves healthy, help our children. I just think it's fascinating when you were talking about when the vaccine came out in 2020. And then I'm assuming, when was it approved or acknowledged for, authorized, I should say, for youngsters? It wasn't too long after that, after the adult vaccine came out, was it, that it was approved for youngsters? Oh.
It depends on how you define children, of course, but
actually, sure.
Adolescents ages 16 and 17 had authorization in December of 2020. In other words, alongside the very first authorizations. And then in May of 2021, we authorized vaccines for ages 12 through 15 years. Then in November of 2021, we were able to age de-escalate, meaning authorize down to ages 5 and above. And then June of this year, we were able to authorize these vaccines for ages 6 months through 4 years. I just want to acknowledge I'm being a little imprecise with my vocabulary here. I should come back sometime and we should discuss the intricacies of authorization and approval and regulation. Yeah. But when I say authorize, I mean FDA authorized these products, and then we at CDC, in collaboration with the Advisory Committee on Immunization Practices, looked at all the data together and decided whether to recommend the use of these vaccines. So in all those cases, actually, authorization happened and then recommendation happened very closely on the heels, because we've all been working together to get these vaccines out there and preventing serious illness and hospitalization and death for everyone that we can.
And that's when the pediatrician, your own personal family pediatrician, plays such a gigantic role, because something like this, our podcast, we only have a limited amount of time, and we're trying to touch on as many topics and to make it as succinct and to clarify as much as we can. But there's nothing like looking at your pediatrician, your male, female pediatrician, in the eye and just talking to them and taking the time in the office to say, okay, you know me, you know my child, you've seen them. This is what we're doing. What do you recommend? That's what parents, they just want to have a peace of mind and in their heart know that they're doing the right thing. And that's when these questions and these opportunities with pediatricians are invaluable, Dr. Twentyman.
Absolutely. I could not agree more. I would so strongly encourage every parent listening, if you've got questions, talk to your pediatrician. If you've got questions, your pediatrician wants to hear from you. They are so eager to talk with you about these vaccines, about other vaccines, about any concerns that you have for your child's health, because your concern is their concern.
Do you think there'll ever be a time that there could be a semblance of a COVID-19 vaccine birth to 6 months? Or does that not, is the mother's immunity still playing such a role in the baby from birth to 6 months that probably would not ever be necessary?
What I'll say is that we're thinking a lot about that. I don't know if any of your listeners had a chance to listen to the Advisory Committee on Immunization Practices meeting of October 18th and 19th. But if they did, you might have heard us chatting about the data about COVID-19 disease in pregnancy and COVID-19 disease in infants, and what vaccination does to protect both of those groups, the pregnant people and the infants. And what's super encouraging is that, well, how about we start with the bad news first and then end with the good news?
Okay,
Because
I'm liking that. Okay.
I just like to do that more.
Yeah.
But the unfortunate news is that COVID-19 disease is unkind to pregnant women and to infants. We know that people who are pregnant have a higher risk of hospitalization, of ICU admission, and of death due to COVID-19 compared with people their ages who are not pregnant. And we know that young infants have a significant risk of hospitalization and death with COVID-19 as well. Here's what's exciting. People who were vaccinated either before or during their pregnancy not only reduced their own risk of serious illness, hospitalization, ICU admission, and death quite significantly. We also saw that their infants were better protected from severe outcomes of COVID-19. And so that was really exciting data to review. I would say if you want to review it, Google ACIP. And once you've found ACIP, you can click on the meeting information and you can see all those slides yourself if you're interested, or listen to the whole recording if you're interested. But it was nice to know that there's at least this one way that we have of protecting pregnant women and infants. And then in terms of whether infants will ever need their own vaccine, I don't know that the jury's in on that yet. I just don't know. So for now, we can say if you're pregnant or planning on becoming pregnant, do get your COVID-19 vaccine. If you've already gotten your vaccine, get boosted. And if you're already boosted with one of the updated boosters, good for you. You are protecting your own health and protecting the health of your future children.
Absolutely. And how encouraging, as you said, Dr. Twentyman. And so you can Google ACIP. Is that correct? That sounds fabulous.
Yep. That stands for Advisory Committee on Immunization Practices. Okay. And, all of ACIP meetings are public. And they're all recorded and everything gets left online for anyone to look at any time, in the interest of just being really transparent with all of the data that exists about COVID-19 and about all of these vaccines and the recommendations that ACIP makes and that CDC makes based on all that data. It's all available. If you want to look, you are welcome to do so. And you're welcome to attend in real time as well.
What a fabulous resource. And that's when you're talking about straight facts. This is not misinformation. You're going right to the source and to the facts. In our waning moments of our conversation today, we did want to just touch on, Dr. Twentyman, to tell us about the fear that the vaccine may be causing heart problems in children and teens. Have you heard that, Dr. Twentyman?
Yes, thank you so much. So, like I said, we are studying these vaccines under the most intensive vaccine safety surveillance in U.S. history. And we did identify a very small risk of myocarditis and pericarditis after mRNA COVID-19 vaccines and after the Novavax COVID-19 vaccine. The risk is rare. It is primarily observed in adolescents and young adult males. And within the first week after receiving the second dose or booster dose of an mRNA COVID-19 vaccine. We also know that most individuals with myocarditis are fully recovered at follow-up. And so that's very encouraging. And we furthermore know that there are things that we can do to reduce that risk of that small risk of myocarditis. If you are a parent of a child of that age, we do offer in our interim clinical considerations for use of these vaccines that you might consider using an interval of 8 weeks between that first and second vaccine dose in the primary series, and then at least 8 weeks again before you get that booster for your child. I do want to say these vaccines are very helpful at preventing COVID-19 and its serious outcomes. And so one of the things that we did in one of our many risk benefit comparisons with these vaccines was to look among males at highest risk of myocarditis after vaccines. We looked to see what their risk of any cardiac outcome after COVID-19 was, to give ourselves like a really meaningful comparison. So in other words, we intentionally used the group with the highest risk of myocarditis, even though this is a very small risk of myocarditis. And we saw that the risk of adverse outcomes to the heart, the risk of adverse cardiac outcomes were 2 to 5.6 times higher after SARS-CoV-2 infection than after mRNA COVID-19 vaccination. And we know that the course of recovery after myocarditis, one of these rare cases of myocarditis, is much more forgiving if this happens after vaccination than if it happens after COVID-19 disease. And if you'll allow me, I want to take this a little bit farther because we're not only interested in these rare risks of myocarditis and pericarditis, we're also wanting to understand every single risk of one of these vaccines and be able to intelligently weigh them against the benefits of these vaccines. This is really critical to what we do at CDC. It's really important to make sure that our vaccine policy decisions always take all of the data into account, both the benefits of the vaccine and every single known risk. So to this end, the Advisory Committee on Immunization Practices has reviewed the balance of benefits and risks very recently. Since authorization of the vaccines, there have been 22 meetings of the Advisory Committee on Immunization Practices focused on these vaccines. We've looked at efficacy data at 11 of those meetings and at safety data at 20 of those meetings. And so we have looked at the benefit, risk, and balance of these vaccines at least once a month since the dawn of these vaccines. And we will continue to do so because we want to make sure that these vaccines are not just effective. We want to make sure that they are safe. And so we have done so, and we will continue to do that in the future.
That's critical information that we need to know because we don't see what goes on, what you do. And there's so much, not just Monday through Friday or whatever. You're doing this 24/7. This is something the CDC, you do it. You need to do it. And you do it because, as you said, the balance and the risk. And it just doesn't stop with one variant or with this or with that or one vaccine. So Dr. Twentyman, in our last few minutes of our podcast today, is there anything you can think of that we've not spoken about or that you would like to make sure that our listeners are crystal clear on anything that you've said or that you've talked about today?
Yes, thank you so much for the opportunity. I'd love to add that at that most recent Advisory Committee on Immunization Practices meeting, the advisory committee decided to vote on the recommended immunization schedule for routine immunizations, that is, for both children and adults, for 2023 forward. And they did vote to include COVID-19 vaccines in that routine schedule. And I wanted to clarify that these routine schedules are a really powerful way that we help keep all clinicians, all vaccine providers up to date, not just with COVID-19 vaccines, but with all vaccines. We want to give providers every resource that we can. And you can find this new vaccine schedule, this new routine immunization schedule at cdc.gov/vaccines/schedules. I wanted to add that practices like physicians and vaccine clinics can order like hard copies of the schedule free to put on their wall, and that this schedule will come out in February of 2023. I did want to note too that inclusion of COVID-19 vaccines in the routine schedule, in the recommended routine schedule, does not mean that these vaccines are mandated. They're not. We at CDC do not do vaccine mandates at all, actually, ever. Not with COVID-19, not with other vaccines. Any consideration of mandates are the job of others, not CDC's at all. But we do want to offer what we think are the routine recommendations to prevent disease and protect the health of all Americans. To this end, we recommended these in routine schedules and then voted for their inclusion in the Vaccines for Children program, just to keep working toward equitable access to COVID-19 vaccines for all ages and all populations. This remains really critically important now, while these vaccines are still available for free through the federal government. And in the future, if these ever become commercial, making sure that these vaccines get included in the Vaccines for Children program is the first step in ensuring that they remain accessible to all children, regardless of their income, moving forward.
Dr. Twentyman, you have been just an incredible guest today. Thank you, thank you, thank you on behalf of everyone here, our podcast, our listeners. We need to know the information, and we know that the information that you've given us today, it's true, it's factual, and we're just so happy that you took the time, because I can't imagine, what you do there at the CDC, that you could carve out the time. But again, as you said, this is so important for everyone to be aware of, to understand, and to not have any fuzzy questions around the edges, but to know what you need to do and how the parents, they have their lives and the health of their children. Like you said, let the children have a healthy and a happy childhood. That's the bottom line.
Absolutely. That is the bottom line. And these vaccines don't protect against severe illness, hospitalization, or death unless they get into the arms of Americans, including American children. And so thank you so much for your help in getting this message out. We so appreciate you. Thank you very much.
Thank you, Dr. Twentyman. And thank you, everyone, for listening to our podcast today. We hope you've enjoyed what a discussion we've had. Thanks to our listeners. Goodbye for now for another VAX Matters.